doctors end up getting into a real bind, whether they're working with the FDA or if they're on staff at a hospital or if they're in a group. They're trapped.
Yep.
They can't go outside that box, because if they step outside that box, their livelihood is gone.
That's a great name for a book. Step outside the box.
Well, we're doing another one.
Hey, speaking about doctors they're trapped, there's also folks that maybe not doctors that are doing this willingly. So,
Yes.
for instance, when we're talking about aspartame, I just think of good old Rumsfeld, right? He was the CEO of GD Searle, which was the company that was trying to get aspartame on the market. Then he got onto Reagan's advisory board, and then shortly thereafter, the FDA commissioner that would not approve aspartame was booted, and a new one came in that was one of Rummy's buddies, and then approved it for GD Searle to distribute. And so you have these cases of, as I've talked about before, I call it the incest factor, where you've got all these different boards of directors and people in decision-making process are in bed with each other, and that's one of the cases there with aspartame, just specifically in that case.
What was the antiviral? I can't even remember. Virusid? I can't remember it. When they were doing all the BS about the swine flu coming through the United States.
Oh yeah, I can't remember.
I can't remember the name of the drug, but again, that was one of the politicians that owned a huge amount of stock and had been previously the CEO of that company.
Right. But you'll always, this is not an exception, it always happens that way.
It always happens that way, and that drug was as useless as tits on a boar, as they say. I mean, it never worked. It had no effect, never could provide legitimate research that showed it had any effect on viruses at all.
But that shouldn't surprise us, because they never can.
No.
I mean, they've even admitted that, for instance, just your common flu vaccine doesn't prevent the common flu, because by the time that it gets through production, it's mutated to such an extent that it doesn't even stop the common flu.
That was, the mutation. Go there for a moment now. We've got bacteria that we can't treat because of overuse of antibiotics in our food supply. Even if you never took an antibiotic in your life, you would not have a normal gut flora from eating the meat and chicken, because they're full of antibiotics. Well, fungal infections now are growing dramatically. When I started practicing 30 years ago, you'd look for perhaps candidiasis. You have a white tongue, you have a discharge, vaginal discharge. And now we're seeing really serious fungal infections. Inflammatory breast cancer has a large fungal side to it, which isn't addressed, by the way, when they're treating it.
Right.
Which is why the results are so abysmal.
Right.
But when I started practicing, you could use a very basic antifungal, nystatin, and it would work virtually every time.
It doesn't work anymore.
No. In the last 20 years, what I like to do is it's called a comprehensive stool analysis. It sounds gross because you're sending in a sample of your feces.
Right.
But what they're able to do with it is actually grow the flora and fauna that are growing in your gut, because they pass out with your feces. So and they do a culture and sensitivity with it. There's a lab called Genova Labs in North Carolina that's probably one of the best in the world. And they'll tell you all of the good flora in your gut. They'll tell you all the pathogenic or bad flora in your gut. And all the pathogenic flora, they'll do cultures and sensitivities on. And they'll give you a choice between using uva ursi, an herb, or one of the iatroconazoles,
and they'll compare the effectiveness.
And compare the effectiveness as well. I have not in 20 years seen any fungal infection at all that was not resistant to nystatin. And these fungal infections are mutating as fast or faster than the bacterial infections. And so we're having to come out with more and more antifungals, and unfortunately the side effects of these antifungals are getting worse and worse and worse, to the point now where we're having to do liver function tests before we give them the drug. Now, if we use herbal antifungals, we don't have that problem.
That's what I was going to say. There's a lot of herbals.
Yeah, there's a myriad of herbal antifungals that work very well as taking probiotics.
Right.
And you can take care of the problem without causing any damage. But we're born with a myriad of diverse flora and fauna in our gut. And when you get these samples back, you'll see 2 or 3 or
They're
4
gone.
that are left.
They're all gone.
All gone. And that's our immune system.
And so that dysbiosis basically is part of one of the many causes of the compromised immune system, isn't it?
Gastrointestinal dysbiosis is one of the primary causes of susceptibility to disease.
Right.
Your gut is 70% of your immune system.
Right. I was going to say that's what I read. 70%.
And if you take away that 70%, it only leaves you 30.
Mm-hmm.
So
Pretty important, isn't it?
it is.
But the things that you put in your mouth that go through your gut have nothing to do with health, though, right? If you're a conventional doctor, they're not taught that. There's
No.
the disconnect, isn't it? There's the disconnect. They're not taught that nutrition or anything that you put in your mouth has anything to do with your health. But in light of the fact that 70% of your immune system is generated in the place where that food goes, you can see why they don't have any idea how to troubleshoot.